Hello and welcome. Do you want to successfully complete the C214 OA exam? Then you are in the right place. We built a free question bank for the C214 OA exam. Preparing for an OA is no joke, so our guides and practice questions are completely free. In this video, we will cover questions from results management, healthcare analytics, performance indicators, strategic frameworks, measurement theory. So, let's get started.
1. A non-profit organization wants to track whether its community outreach program is creating long-term social change over several years in a results-based management framework. Which stage of the result chain best captures these sustained broad societal effects that emerge well after initial program delivery? A. Outcome stage measuring short-term effects. B. Output stage measuring delivered services. C. Impact stage measuring long-term effects. D. Activities stage measuring action plans. Can you guess the answer? Correct answer, C. Impact stage measuring long-term effects. Explanation. Option C is correct because the impact stage in results-based management specifically measures long-term effects of a program, including sustained economic, environmental, cultural, or political changes that develop over extended time periods. Option A is incorrect because the outcome stage captures only short-term effects, such as greater efficiency or changed opinions, not the sustained broad societal changes that develop over many years after initial delivery. Option B is incorrect because the output stage refers to the goods, services, or systems produced by program activities, not the lasting societal effects that emerge years after those outputs are initially delivered. Option D is incorrect because the activities stage involves processes that convert inputs into outputs, such as training or developing action plans, and it does not address the measurement of any long-term change. Alright, let's get into a concept that trips up a lot of students: the result chain in results-based management. The question here is about a non-profit tracking whether its community outreach program is creating long-term social change over several years. That phrase, long-term social change over several years, is doing all the heavy lifting. In results-based management, the result chain moves through a specific sequence: inputs, activities, outputs, outcomes, and finally, impact. Each stage captures something different. Outputs are the things you actually deliver: the services, the reports, the training sessions. Outcomes are the short-term effects you see soon after delivery. Maybe people start using a new service or change their behavior a bit. But impact is the big picture. It's the sustained economic, environmental, cultural, or political changes that develop long after the program wraps up. Think years down the road. So when the question says sustained broad societal effects that emerge well after initial program delivery, that's textbook impact stage language. The output stage is wrong because it's just about what got delivered. The outcome stage is wrong because it only covers short-term shifts. And the activities stage is about the work, processes themselves. Training people, running campaigns. Not measuring anything long-term. Here's a WGU C214 OA exam tip for you. When you see a question mentioning long-term, sustained, or broad societal effects that's pointing straight at the impact stage, quick recall hook: impact equals imprint. Think of the lasting imprint a program leaves on society years later. 2. A government agency has launched a new literacy program and needs to classify its spending on staff salaries, training materials, and office space within its results-based management system. Which stage of the result chain should these foundational resources be categorized under before any program work begins? A. Input stage for resources used. B. Activities stage for work processes. C. Output stage for delivered products. D. Outcome stage for observed effects. What do you think is the answer? Correct answer, A. Input stage for resources used. Explanation. Option A is correct because the input stage in results-based management defines the human and financial resources allocated to the system, including staff, funding, and infrastructure that are needed before work begins. Option B is incorrect because the activities stage involves actual processes that transform inputs into outputs, such as conducting training sessions or launching media campaigns, not the initial allocation of foundational resources. Option C is incorrect because the output stage represents tangible results created by activities, such as published materials or launched services, and these cannot exist before resources are first allocated to the program. Option D is incorrect because the outcome stage measures short-term effects that outputs produce, such as improved decision-making or behavioural changes which occur much later than the initial resource identification stage. Now let's look at the very beginning of the result chain, the input stage. A government agency launches a literacy programme and needs to classify spending on staff salaries, training materials, and office space. Notice those items: salaries, materials, space. These are all resources that exist before any actual program work starts. In results-based management, the input stage is where you define the human and financial resources allocated to a system: staff, funding, infrastructure. All inputs. They're the raw ingredients. You can't run a training session without first having trainers and a building. The activities stage is different. That's where you actually do things with those resources, like conducting workshops or launching campaigns. Outputs are what activities produce: published guides, completed sessions, and outcomes measure the effects of those outputs. So the sequence matters. Inputs come first. Activities use inputs. Outputs come from activities. Outcomes come from outputs. The question specifically says before any program work begins, which locks you into the input stage. Here's a WGUC 214 OA exam tip for you. If a question lists resources like staff, money, buildings, or materials and says they're allocated before work starts, that's always the input stage. Quick recall hook. Inputs are ingredients. Before you cook, you gather your ingredients. 3. An international development organisation discovers that staff members are not reporting their own progress towards shared goals, and departments are operating in isolation. Which essential principle of making results-based management work is this organisation most clearly failing to uphold in its operations? A. Flexibility in data collection techniques. B. Simplicity with fewer complex indicators. C. Transparency with clearly defined roles. D. Joint accountability and shared responsibility. What do you think is the answer? Correct answer. D. Joint accountability and shared responsibility. Explanation. Option D is correct because results-based management requires all participants to manage and accept responsibility jointly, including reviewing their own work and reporting progress toward results, which this organisation clearly lacks. Option A is incorrect because flexibility in data collection is important for adapting evaluation techniques over time. But the core problem here is that staff are not taking ownership of reporting and departments work in isolation. Option B is incorrect because simplifying indicators helps with role clarity and evaluation processes. But the fundamental issue is the absence of collaborative accountability and shared self-reporting across the entire organisation today. Option C is incorrect because transparency and defined roles matter in results-based management. But the scenario specifically highlights failures in joint ownership of results and mutual progress reporting between the isolated departments. This one zeroes in on a principle that makes results-based management actually work in practice. The scenario describes staff members not reporting their own progress and departments operating in complete isolation from each other. So what principle is broken here? It's joint accountability and shared responsibility. Results-based management requires every participant to manage and accept responsibility jointly. That means reviewing your own work, reporting your own progress, and sharing that information across the organization, not hiding in your departmental silo. Now, the other options touch on real concepts, but miss the mark for this scenario. Flexibility in data collection is about adapting your evaluation methods over time. That's not the problem when people refuse to self-report. Simplicity with fewer indicators helps reduce confusion, but the core failure here is people not owning their piece of the results puzzle. Transparency with defined roles matters, sure, but the scenario describes something more specific, a breakdown in mutual accountability where nobody takes ownership of shared goals. Here's a WGU C214 OA exam tip for you. When a question describes departments working in isolation and staff not self-reporting, the answer is joint accountability. The keyword isolation is your signal. Quick recall hook. Silos kill sharing. If you see silos in the question, think shared responsibility. 4. A non-profit has completed its media campaign, and new counselling services are now actively being used by members of the target community. In the results-based management result chain, what stage does this scenario best represent when the delivered services begin producing their initial observable effects? A. Output stage where services launch. B. Outcome stage showing short-term effects. C. Impact stage showing long-term change. D. Activity stage converting inputs to outputs. Can you guess the answer? Correct answer, B. Outcome stage showing short-term effects. Explanation. Option B is correct because the outcome stage captures short-term effects of outputs, such as increased usage of services, greater efficiency, or changed public opinions that emerge soon after program delivery is completed. Option A is incorrect because the output stage refers to when goods and services themselves are created and delivered, such as the media campaign launching, not the subsequent effects of people actively using those services. Option C is incorrect because the impact stage addresses long-term effects like economic or cultural change developing over extended periods, not the initial observable uptake of services by the target community after delivery. Option D is incorrect because the activities stage involves processes used to convert resources into outputs, such as recruiting counsellors or preparing campaigns, and it occurs well before services produce any visible effects. Let's talk about the outcome stage, the part of the result chain that sits right between outputs and impact. The scenario tells us a non-profit finished its media campaign, counselling services are now live, and community members are actually using those services. The key detail: delivered services are producing their initial observable effects. That's the outcome stage. Outcomes capture what happens in the short term after outputs land. People show up, behaviours shift a little, efficiency goes up, opinions start changing. It's the first wave of measurable effects. The output stage would be the media campaign launching and the counselling service becoming available. Those are the deliverables themselves. The impact stage is way further down the timeline. We're talking years of sustained societal change. And the activity stage is the behind-the-scenes work of building the campaign and training counsellors long before anyone walks through the door. The distinction between outputs and outcomes is one of the trickiest on this exam. Outputs are what you produce. Outcomes are the first effects of what you produced. Here's a WGU C214 OA exam tip for you. If a question says services are being used or showing initial effects, that's the outcome stage. The moment people start responding to what was delivered, you've moved past outputs. Quick recall hook. Outcomes are the aftershock. Outputs land, and outcomes are the first ripple. 5. A results-based management system requires continuous monitoring and evaluation to function properly. Which characteristic best explains why this management approach is described as a life cycle approach, where processes must be ongoing rather than performed as a single event at the end of a project. A. It cycles through planning and evaluation. B. It uses only financial indicators. C. It requires annual external audits. D. It relies on one-time data collection. What do you think is the answer? Correct answer, AA. It cycles through planning and evaluation. Explanation. Option A is correct because results-based management takes a lifecycle approach requiring constant planning, monitoring, evaluating, and executing, making it a continuous cyclical process rather than a single one-time assessment. Option B is incorrect because results-based management uses measurable data extending beyond financial indicators alone, including performance data from monitoring and evaluation processes that cover all types of organizational results. Option C is incorrect because the life cycle nature of results-based management refers to internal, continuous processes of planning and evaluation, not to a requirement for annual audits that are conducted by external parties. Option D is incorrect because one-time data collection directly contradicts the core principle of results-based management, which channels performance data from monitoring and evaluation process continuously throughout all its operations. This question tests whether you understand why results-based management is called a life cycle approach. The answer is straightforward. It cycles through planning, monitoring, evaluating, and executing continuously. It's not a one-and-done deal. You don't plan once, execute once, check once, and call it a day. Results-based management channels performance data from monitoring and evaluation back into the planning process on a continuous loop. That's what makes it a life cycle. The process feeds back into itself over and over. Option B says it uses only financial indicators, which is wrong. Results-based management tracks all kinds of measurable data, not just money. Option C suggests annual external audits, but the life cycle nature is about internal continuous processes, not waiting around for an outside auditor once a year. And option D, one-time data collection, is the exact opposite of what results-based management stands for. The whole point is that data collection never stops. Here's a WGU C214 OA exam tip for you. When a question asks why results-based management is a life cycle approach, the answer always involves continuous cycling through planning and evaluation. The word continuous is your anchor. Quick recall hook. Life cycle equals never-ending loop. Plan, monitor, evaluate, execute, repeat. 6. A public health official needs to determine where to allocate emergency medical resources across multiple regions affected by a disease outbreak. Which epidemiological measure would be most appropriate for identifying the regions with the greatest existing burden of disease to guide immediate resource deployment decisions? A. Cumulative incidence of new cases. B. Incidence rate using person time units. C. Ratio comparing two population groups. D. Prevalence measuring all existing cases. Do you know the answer? Correct answer. D. Prevalence measuring all existing cases. Explanation. Option D is correct because prevalence measures all existing cases of a disease in a population at a given time, making it the ideal measure for determining where relief and resources are most urgently needed now. Option A is incorrect because cumulative incidence measures only new cases arising during a specific time period and is better suited for identifying which populations face the highest risk of contracting the disease going forward. Option B is incorrect because the incidence rate uses person time units to measure changing levels of risk over time and is more useful for evaluating whether specific treatments or preventative measures are working effectively. Option C is incorrect because a simple ratio comparing groups can be misleading without accounting for population sizes, as shown by comparing raw disease counts between countries with vastly different total populations. A public health official needs to figure out where to send emergency medical resources during a disease outbreak. The goal is to identify which regions have the greatest existing burden of disease right now. The measure that fits this scenario is prevalence. Prevalence counts all existing cases of a disease in a population at a specific point in time, both new and old cases combined. When you need to know where the sickest people currently are so you can deploy resources today, prevalence is the right tool. Cumulative incidence only counts new cases over a time period, which tells you about future risk but not the current total burden. Incidence rate uses person-time units to track changing risk levels. That's useful for evaluating treatments, not for deciding where to send ambulances. And a simple ratio comparing two groups can mislead you badly if you don't account for population sizes. A country with 10,000 cases and a population of 1 billion is in much better shape than a country with 5,000 cases and a population of 50,000. Here's a WGU C214 OA exam tip for you. When a question mentions existing burden, current cases, or where to allocate resources now, that's prevalence. Prevalence is the snapshot measure. Quick recall hook. Prevalence equals present picture. It tells you what's happening right now. 7. A researcher wants to evaluate whether a newly introduced preventive treatment is effectively slowing the spread of a disease across a population over an extended observation period. Which epidemiological measure would best capture the changing levels of risk over time to assess this treatment effectiveness? A. Prevalence of all current cases. B. Cumulative incidence of new cases. C. Incidence rate with person-time units. D. Simple ratio of two population groups. What do you think is the answer? Correct answer, C. Incidence rate with person-time units. Explanation. Option C is correct because the incidence rate uses person-time units as a cumulative measure of observation time, making it specifically designed to capture changing risk levels and evaluate treatment effectiveness over time. Option A is incorrect because prevalence counts all existing cases at a single point in time without distinguishing old from new cases, so it cannot effectively measure whether a new treatment is actively slowing ongoing disease spread. Option B is incorrect because cumulative incidence measures the proportion of new cases during a time period, but does not incorporate varying observation lengths for individuals, limiting its ability to track changing risk levels. Option D is incorrect because a simple ratio compares one quantity to another at a fixed point and does not incorporate the critical time dimension that is necessary for evaluating whether risk levels are changing due to treatment. Now we flip the scenario. Instead of finding out where disease currently sits, a researcher wants to evaluate whether a new preventive treatment is actually slowing disease spread over time. The measure that captures changing risk levels over an extended observation period is the incidence rate with person-time units. Person-time is the key concept here. It adds up all the observation time contributed by each person in the study, accounting for the fact that people enter and leave studies at different points. This makes the incidence rate especially good at measuring how risk changes as conditions change. Like when a treatment gets introduced. Prevalence won't work because it just gives you a count of all cases at one moment, mixing old and new together. It can't tell you if new cases are slowing down. Cumulative incidence counts new cases, but doesn't account for different observation lengths across individuals. And a simple ratio has no time dimension at all. Here's a WGU C214 OA exam tip for you. When a question mentions treatment effectiveness, changing risk over time, or person time, the answer is incidence rate. The time dimension is what separates incidence rate from everything else. Quick recall hook. Incidence rate equals risk over time. Person time is the clock that keeps ticking. 8. When comparing disease frequency between countries of vastly different population sizes, using raw case counts alone can produce highly misleading conclusions about which country is more severely affected. What analytical approach corrects this distortion by accounting for the relative size of each population being studied? A. Measuring proportion of population affected. B. Calculating cumulative incidence over time. C. Using simple ratios of raw case numbers. D. Applying incidence rate with person time units. What do you think is the answer? Correct answer. A. Measuring proportion of population affected. Explanation. Option A is correct because measuring the proportion of a population affected accounts for differences in total population size, providing an accurate comparison of disease burden that raw case numbers alone cannot offer. Option B is incorrect because cumulative incidence measures new cases over time relative to population, which serves a different purpose than correcting the misleading impression created by directly comparing raw case counts between countries. Option C is incorrect because using simple ratios of raw case numbers is exactly the approach creating misleading conclusions, as it entirely ignores population size differences between the countries being compared in the analysis. Option D is incorrect because incidence rate accounts for time under observation rather than population size directly, and the specific correction for misleading cross-country raw count comparisons requires using population proportions instead. Here's a classic problem in epidemiology. You're comparing disease frequency between two countries with very different population sizes. Country A has 10,000 cases, but a population of 1 billion. Country B has 500 cases and a population of 10,000. If you just compare raw numbers, country A looks way worse. But is it? Not even close. The fix is measuring the proportion of the population affected. A proportion compares part of a group to the whole group. So you take disease cases divided by total population. That immediately corrects the distortion caused by different population sizes. Cumulative incidence measures new cases over time relative to population. Useful, but it's answering a different question about future risk. A simple ratio of raw case numbers is literally the problem the question describes, not the solution. An incidence rate accounts for observation time, which isn't what's needed to fix a cross-country raw count comparison. Here's a WGUC 214 OA exam tip for you. When a question says comparing between populations of different sizes or raw counts are misleading, the fix is proportion. Proportion adjusts for population size. Quick recall hook. Proportion fixes the population problem. Different sizes? Divide by the whole. 9. A university epidemiologist has collected data showing that unvaccinated students living in dormitories have a significantly higher disease incidence rate than vaccinated off-campus students. When presenting this data to lawmakers who oppose mandatory vaccination, which analytical approach would most strengthen the argument for requiring immunisation? A. Comparing raw case counts between groups. B. Calculating rate ratios between subgroups. C. Measuring overall campus prevalence only. D. Using simple proportions without categories. Can you guess the answer? Correct answer. B. Calculating rate ratios between subgroups. Explanation. Option B is correct because rate ratios directly quantify how many times more likely one subgroup is to contract a disease compared to another, providing compelling evidence of the protective effects of vaccination. Option A is incorrect because raw case counts do not account for group sizes and can produce misleading comparisons, making them a weak foundation for constructing persuasive policy arguments before skeptical opposing lawmakers. Option C is incorrect because overall campus prevalence combines all students into one figure, hiding the critical differences between vaccinated and unvaccinated groups that form the strongest possible argument for mandatory vaccination. Option D is incorrect because using proportions without breaking data into meaningful categories, like vaccination status and residential setting, fails to reveal the specific risk factors that justify implementing a mandatory policy. This question adds a persuasion layer to epidemiology. A university epidemiologist has data showing unvaccinated dorm students have higher disease rates than vaccinated off-campus students. Now, the epidemiologist needs to present this to lawmakers who oppose mandatory vaccination. The best tool for making a compelling argument is the rate ratio. A rate ratio directly quantifies how many times more likely one group is to get sick compared to another. Saying unvaccinated students are 4 times more likely to contract the disease is far more powerful than saying there were more cases among unvaccinated students. Raw case counts are weak because they don't account for group sizes. If the unvaccinated group is much larger, of course they'll have more cases. Overall campus prevalence lumps everyone together and hides the exact difference between vaccinated and unvaccinated groups, which is the whole point of the argument. Proportions without categories give you a general picture, but don't break it down by the specific risk factors that justify a policy change. Here's a WGU C214 OA exam tip for you. When a question involves comparing risk between 2 specific groups and making a persuasive case, rate ratios are the answer. They put a multiplier on the comparison. Quick recall hook. Rate ratio equals risk multiplier. X times more likely is the phrase that wins arguments. 10. In epidemiology, researchers use 3 fundamental statistical concepts to study raw health data and convert it into meaningful information for public health decisions. Which of the following correctly distinguishes between a rate and a proportion, as they are specifically applied in the study of disease frequency? A. Both measure identical things differently. B. Rates exclude time while proportions include C. Proportions compare unrelated populations only. D. Rates include time while proportions compare parts. Can you guess the answer? Correct answer, D. Rates include time while proportions compare parts. Explanation. Option D is correct because a rate measures events occurring over a time period, such as births per year, while a proportion compares part of a group to the whole group, like disease cases to total population. Option A is incorrect because rates and proportions measure fundamentally different things in epidemiology. Rates incorporate a time dimension showing event frequency, whereas proportions show relative size without necessarily requiring a time component. Option B is incorrect because this completely reverses the actual definitions used in epidemiology. Rates specifically include a time dimension in their measurement, while proportions compare subsets to the whole without requiring a time element. Option C is incorrect because proportions specifically compare a part of a group to its own whole group, not to unrelated populations, making them useful for understanding how much of a single specific population is affected by disease. This is a definition question, but it's one you need to nail because the terms come back in harder scenarios later. The question asks you to distinguish between a rate and a proportion in epidemiology. A rate measures events occurring over a time period. Births per year, deaths per month, new infections per person year. Time is baked into the measurement. A proportion, on the other hand, compares part of a group to the whole group, like the fraction of a population with a disease. No time dimension required. Option A says both measure identical things differently, but that's wrong. They measure fundamentally different things. Option B reverses the definitions completely, saying rates exclude time while proportions include it. That's backwards. Option C claims proportions compare unrelated populations, but proportions specifically compare a subset to its own whole group. Here's a WGU C214 OA exam tip for you. The word time is the dividing line. If the measure includes a time component, it's a rate. If it's just part to whole without time, it's a proportion. Quick recall hook. Rate has a T, and so does time. Proportion has a P, and so does part to whole. 11. A hospital administrator wants to select a metric that will effectively measure organizational success, but the chosen metric must be specific, quantifiable, realistic, aligned with the hospital mission, and evaluated within a defined period. Which established framework best guides the selection of such performance indicators? A. SMART criteria for performance indicators. B. Balanced scorecard with 4 perspectives. C. Net promoter, score for customer loyalty. D. Cost-benefit analysis for project evaluation. What do you think is the answer? Correct answer, A. SMART criteria for performance indicators. Explanation. Option A is correct because SMART criteria require key performance indicators to be specific, measurable, attainable, relevant and time-bound, directly matching all the characteristics the hospital administrator described in the scenario. Option B is incorrect because the balanced scorecard is a broader framework measuring performance across 4 organisational perspectives, not a specific set of criteria designed for evaluating whether an individual metric is truly appropriate. Option C is incorrect because the Net Promoter Score is one specific metric measuring customer loyalty through survey responses, not a framework for guiding the selection and systematic evaluation of appropriate organisational performance indicators. Option D is incorrect because cost-benefit analysis is a technique for evaluating whether project benefits justify costs, and it does not provide criteria for selecting specific organisational performance indicators to measure ongoing success. All right, shifting gears to performance measurement. A hospital administrator wants to pick a metric that's specific, quantifiable, realistic, aligned with the hospital's mission, and evaluated within a defined period. Read those words again carefully. Specific, measurable, attainable, relevant, time-bound. That spells SMART. The SMART criteria framework is designed exactly for this. It gives you a checklist for evaluating whether a performance indicator is actually good enough to use. The balanced scorecard is a broader framework that organises performance across 4 perspectives: financial, customer, internal processes and learning. It doesn't tell you whether a single metric is well constructed. The Net Promoter Score is one specific metric for customer loyalty. It doesn't guide how to select other metrics. And cost-benefit analysis evaluates whether a project's benefits outweigh its costs. None of these do what SMART does, which is evaluating the quality of an individual indicator. Here's a WGUC 214 OA exam tip for you. Whenever a question lists characteristics like specific, measurable, attainable, relevant, and time-bound, even if it doesn't use the word SMART, that's your answer. Match the characteristics to the acronym. Quick recall hook. SMART is the quality test for metrics. If they're describing what makes a good metric, it's SMART. 12. A company discovers that while its individual key performance indicators each show adequate results in isolation, managers struggle to understand how multiple related metrics interact to reveal the complete organisational picture. Which visualization tool best addresses this limitation by combining related indicators into one unified view? A. A single trend line chart over time. B. A Net Promoter Score survey results. C. A performance dashboard display. D. A standard financial income statement. Can you guess the answer? Correct answer, C. A performance dashboard display. Explanation. Option C is correct because a performance dashboard brings together different charts and graphs representing related variables into one unified view, specifically designed for situations where individual data points cannot show the full picture. Option A is incorrect because a single trendline chart tracks only one variable over time and cannot combine multiple related key performance indicators into the integrated view that managers need for comprehensive organisational understanding. Option B is incorrect because a Net Promoter Score is one customer loyalty metric, providing a single data point about customer perceptions. not a tool for combining multiple diverse organizational performance indicators into a unified display. Option D is incorrect because a financial income statement presents only financial data in a fixed accounting format and cannot integrate the diverse operational, customer, and growth metrics that together form a complete performance picture. Here's a practical problem managers face all the time. Individual KPIs look fine in isolation, but nobody can see how they connect to tell the bigger story. The answer is a performance dashboard. A dashboard brings together different charts, graphs, and metrics into one unified visual display. It's specifically designed for those situations where isolated data points can't reveal the full picture. Think of it like a car dashboard. Speedometer, fuel gauge, temperature, RPMs. Each one tells you something, but you need to see them all at once to know if the car is running well. A single trendline chart only tracks one variable over time. Useful, but too narrow. The Net Promoter Score is just one metric about customer loyalty. It's a single data point, not an integrating tool. A financial income statement only shows financial data in an accounting format. It can't pull in operational, customer, or growth metrics. Here's a WGU C214 OA exam tip for you. When a question says managers need to see multiple metrics together or understand how indicators interact, that's a dashboard. The keyword is unified view. Quick recall hook. Dashboard equals driver's seat view. All your gauge is one glance. 13. An organization has invested heavily in establishing its key performance indicators and monitoring systems. But market conditions have shifted dramatically, and the existing metrics no longer align with updated strategic objectives. Which recognized disadvantage of KPIs does this scenario most clearly illustrate? A. KPIs require frequent ongoing maintenance. B. KPIs are difficult to change once designed. C. Small KPI changes lack statistical significance. D. KPIs provide only rough performance guides. Can you guess the answer? Correct answer, B. KPIs are difficult to change once designed. Explanation. Option B is correct because a recognized disadvantage of KPIs is that once designed and set up, they become difficult to change, which is precisely the problem when market shifts make existing metrics strategically misaligned. Option A is incorrect because while KPIs require frequent maintenance and monitoring, the scenario describes needing fundamental change due to strategic misalignment, which is a different problem than routine upkeep of existing performance measures. Option C is incorrect because the concern about statistical significance relates to interpreting small movements in KPI values, not the broader organizational challenge of needing to completely redesign metrics after a fundamental strategic shift. Option D is incorrect because KPIs being rough guides concerns their overall precision as indicators, not the specific structural difficulty of redesigning an entire KPI system when organizational strategy fundamentally changes its direction over time. This question hits on a real disadvantage of KPIs that catches organizations off guard. A company invested heavily in building out its KPI system, but then the market shifted and those metrics no longer match the new strategic direction. The problem? KPIs are difficult to change once designed. Once you've built the measurement infrastructure, trained staff on it, and embedded it into reporting routines, tearing it down and rebuilding is expensive and disruptive. That's a recognized downside. Frequent maintenance is a different issue. That's about the ongoing upkeep of existing KPIs, not the difficulty of fundamentally changing them. Statistical significance concerns apply to interpreting small movements in KPI values, not to redesigning the entire system. And KPIs being rough performance guides is about their precision as indicators, not about how hard they are to swap out when strategy changes. Here's a WGU C214 OA exam tip for you. When a question describes a strategic shift making existing metrics obsolete and the organization struggling to adapt, the answer is that KPIs are difficult to change once designed. Look for invested heavily plus no longer align. Quick recall hook. KPIs are sticky. Once built, that they resist change. 14. A university tracks whether students complete enough competency units each term to remain on schedule for on-time graduation, and uses this data alongside retention and satisfaction metrics to identify which programs need improvement. This approach to institutional measurement best exemplifies which concept in performance analytics? A. Net Promoter Score for student loyalty. B. Cost-benefit analysis of program funding. C. Balanced scorecard financial perspective. D. Key performance indicators in education. What do you think is the answer? Correct answer. D. Key performance indicators in education. Explanation. Option D is correct because tracking competency, unit completion, retention, satisfaction, and graduation rates are specific key performance indicators that educational institutions use to measure student success and identify needed program improvements. Option A is incorrect because Net Promoter Score specifically measures whether customers would recommend a product or service, and this scenario describes academic progress tracking metrics rather than student recommendation, likelihood measurement. Option B is incorrect because cost-benefit analysis compares the financial costs of a program against its generated benefits to determine investment worthiness, not the tracking of student competency completion and program quality indicators. Option C is incorrect because the balanced scorecard financial perspective focuses on measures like revenue growth and return on investment, whereas this scenario describes academic performance tracking across multiple student success dimensions. A university tracks whether students complete enough competency units each term to stay on schedule for graduation, and it uses this alongside retention and satisfaction data to spot which programs need attention. What concept does this represent? Key performance indicators in education. KPIs aren't just a business thing. Educational institutions use them too. Competency completion rates, retention rates, satisfaction scores, and graduation rates are all KPIs that measure student success and program health. The Net Promoter Score measures whether customers would recommend something, which isn't what's happening here. This is academic progress tracking, not a recommendation survey. Cost-benefit analysis compares financial costs against benefits for investment decisions. That's not what tracking competency units does. And the balanced scorecard financial perspective focuses on revenue, returns, and financial performance. This scenario covers multiple student success dimensions, not financial results. Here's a WGU C214 OA exam tip for you. When a question describes tracking specific measurable outcomes in education, graduation rates, completion rates, retention, those are KPIs applied to an educational setting. Don't overthink it. Quick recall hook. KPIs work everywhere. Completion, retention, satisfaction in a school, educational KPIs. 15. A company wants to establish a system that compares its current key performance indicator values against the same indicators from previous time periods to understand whether organizational performance is improving or declining over time. Which recognized advantage of KPIs does this practice directly leverage? A. Creating an internal benchmarking system. B. Educating management on current performance. C. Making data-driven results more quantifiable. D. Using KPIs as a cross-organizational tool. What do you think is the answer? Correct answer. A. Creating an internal benchmarking system. Explanation. Option A is correct because a recognized advantage of KPIs is that when used over time, they create an internal benchmarking system, which is exactly what comparing current values against previous historical period values accomplishes. Option B is incorrect because educating management on performance is a general KPI advantage, but the practice described focuses on temporal comparison across periods rather than simply informing managers about the current state of affairs. Option C is incorrect because making results quantifiable through data is a general advantage of all KPIs, but the scenario specifically describes comparing indicators across time periods, which is the distinct internal benchmarking advantage. Option D is incorrect because using KPIs across an entire organization refers to their applicability across departments and teams, not to the specific practice of comparing performance measurements across different historical time periods. This one is about a specific advantage of KPIs. A company wants to compare its current KPI values against the same indicators from previous time periods to see if performance is getting better or worse. That practice is called internal benchmarking. When you measure the same KPIs over time, you build a historical baseline that lets you track trends, spot improvements, and catch declines. You're benchmarking against yourself. Educating management on performance is a general benefit of all KPIs, but it's too vague for this scenario. The question specifically describes comparing across time periods. Making results quantifiable is also a general KPI advantage, not the distinct practice of temporal comparison. And using KPIs as a cross-organizational tool refers to applying them across departments, not comparing the same metric at different points in time. Here's a WGU C214 OA exam tip for you. When a question mentions comparing current KPI values to historical values or previous periods, the advantage being described is internal benchmarking. Time comparison is the giveaway. Quick recall hook. Same metric, different time equals internal benchmark. You're racing against your past self. 16. A manufacturing company is evaluating its strategy by examining financial returns, customer retention, production cycle times, and employee skill development simultaneously. Which performance measurement framework is specifically designed to incorporate this balanced mix of both financial and non-financial measures across 4 distinct organizational perspectives? A. Key Performance Indicator Dashboard. B. Net Promoter Score Evaluation System. C. Balanced Scorecard Measurement Framework. D. Cost-Benefit Analysis for Project Evaluation. Can you guess the answer? Correct answer, C. Balanced Scorecard Measurement Framework. Explanation. Option C is correct because the balanced scorecard developed by Kaplan and Norton specifically measures organizational performance across 4 perspectives: financial, customer, internal business processes, and learning and growth together. Option A is incorrect because a KPI dashboard displays selected performance indicators visually, but is not a structured framework requiring measurement across 4 specific balanced perspectives of organizational performance at the same time. Option B is incorrect because the Net Promoter Score is a single metric focused exclusively on customer loyalty through one survey question, not a multi-perspective balanced evaluation framework for measuring entire organizational performance. Option D is incorrect because cost-benefit analysis is a financial evaluation technique comparing project costs against benefits, and it does not encompass the balanced, multi-perspective approach needed for ongoing organizational performance measurement. A manufacturing company examines financial returns, customer retention, production cycle times, and employee skill development all at the same time. The framework built to do exactly that is the Balanced Scorecard. Developed by Kaplan and Norton, the Balanced Scorecard organizes performance measurement across 4 perspectives: financial, customer, internal business processes, and learning and growth. Financial returns fit the financial perspective. Customer retention fits the customer perspective. Production cycle times fit internal processes. Employee skill development fits learning and growth. That's all 4, working together. A KPI dashboard displays metrics visually, but isn't a structured framework, requiring 4 specific balanced perspectives. The Net Promoter Score is one metric focused on customer loyalty through a single survey question. It's not a multi-perspective evaluation system. Cost-benefit analysis compares project costs against benefits and doesn't offer balanced, ongoing organizational measurement. Here's a WGUC 214 OA exam tip for you. When a question lists metrics spanning financial, customer, internal processes and learning growth, and asks which framework covers all four, it's always the balanced scorecard. 4 perspectives is the signature. Quick recall hook, BSE equals 4 lenses. Financial, customer processes, learning. Always 4. 17. A company finds that its actual customer satisfaction rate is 97%, while its target was 95%, producing a positive variance. When interpreting this result within a balanced scorecard context, how should management classify this variance given that higher customer satisfaction values are desirable for the organization? A. Favorable because actual exceeds the target. B. Unfavorable because variance is positive. C. Neutral because the difference is small. D. Unfavorable because targets were set incorrectly. What do you think is the answer? Correct answer. A. Favorable because actual exceeds the target. Explanation. Option A is correct because a favorable variance occurs when the variance is positive and a higher value is better for the company. Exactly the case when actual customer satisfaction exceeds the established target. Option B is incorrect because a positive variance is not automatically unfavorable in balanced scorecard analysis. Favorability depends on whether higher or lower values benefit the company, and exceeding customer satisfaction targets is desirable. Option C is incorrect because variance analysis does not classify results as neutral based on magnitude. Any variance where actual performance exceeds the target for a metric where higher is desirable is classified as favorable. Option D is incorrect because the scenario presents a straightforward case where actual performance exceeded expectations, and questioning target accuracy is entirely unrelated to properly classifying the observed variance as favorable or unfavorable. Variance analysis on the balanced scorecard is simpler than students make it. A company's actual customer satisfaction is 97% versus a target of 95%. The variance is positive. Actual exceeds target. And for customer satisfaction, higher is better, so the variance is favorable. That's the rule. A favorable variance happens when the variance is positive and a higher value benefits the company. An unfavorable variance happens when the variance is positive, but a higher value is bad, like when costs exceed the budget. Context matters. Option B says a positive variance is automatically unfavorable, which ignores the direction of desirability. Whether positive variance is good or bad depends entirely on whether higher is better for that specific metric. Option C tries to dismiss the variance as neutral because the difference is small. Variance analysis doesn't work that way. There's no neutral classification based on magnitude. Any amount that exceeds a desirable target is favorable. Option D questions whether targets were set correctly, which is a completely separate issue from classifying the observed variance. Here's a WGUC 214 OA exam tip for you. For variance questions, always ask 2 things. Is the variance positive or negative, and is higher better or worse for this metric? If positive and higher is better, it's favorable. Quick recall hook. Favorable equals good direction. Positive variance plus higher is better equals favorable. Always. 18. A hospital implemented a balanced scorecard, but discovered that different departments defined measurement criteria inconsistently. Staff collected data at varying frequencies, and siloed information technology systems prevented cross-departmental data sharing. Which major challenge of implementing a balanced scorecard does this scenario most directly illustrate? A. Difficulty maintaining organizational momentum. B. Failure to link operations with strategy. C. Inability to show full financial performance. D. Requiring wide cross-section organizational involvement. What do you think is the answer? Correct answer. D. Requiring wide cross-section organizational involvement. Explanation. Option D is correct because a recognized BSc disadvantage is requiring a wide cross-section of organizational departments in developing the system, and inconsistent implementation across departments directly demonstrates this challenge. Option A is incorrect because maintaining momentum is a separate BSc disadvantage, but this scenario describes problems with inconsistent data definitions and siloed systems across departments, which is fundamentally a coordination challenge. Option B is incorrect because failing to link operations with strategy is a potential consequence of poor BSc implementation. But the root problem described is inability to coordinate consistent measurement practices across diverse departments. Option C is incorrect because inability to show full financial performance is a recognized BSc limitation. But the scenario specifically describes challenges with cross-departmental data consistency and IT system integration, not financial reporting. A hospital tries to implement a balanced scorecard but runs into a wall. Different departments define measurements inconsistently, staff collect data at different frequencies, and siloed IT systems block cross-departmental sharing. Which BSc challenge is this? It's the requirement for wide cross-section organizational involvement. One of the recognized disadvantages of the balanced scorecard is that it demands coordination across a wide cross-section of departments. Everyone needs to agree on definitions, timelines, and systems. When that coordination falls apart, you get exactly what this hospital is dealing with: inconsistent criteria, mismatched data collection, and technology barriers. Maintaining organizational momentum is a separate BSc challenge, but that's about sustaining energy and focus over time, not about departments failing to coordinate. Failing to link operations with strategy is a potential consequence of bad BSc implementation, not the root cause described here. An inability to show full financial performance is a BSc limitation, but this scenario is about cross-departmental coordination, not financial reporting gaps. Here's a WGU C214 OA exam tip for you. When a question describes inconsistent definitions, mismatched data collection, or siloed systems across departments, the BSc challenge is wide cross-section involvement. Look for different departments plus inconsistent. Quick recall hook. BSc needs the whole organization. Silos and inconsistency mean the cross-section failed. 19. A rail company's general manager observed that safety metrics were improving while on-time performance was declining on a high-level dashboard, and concluded that safety procedures were causing train delays. What fundamental analytical error did the manager commit by drawing this causal conclusion from the dashboard data? A. Ignoring the financial perspective entirely. B. Confusing correlation with causation. C. Failing to use SMART criteria properly. D. Selecting inappropriate key performance indicators. Can you guess the answer? Correct answer. B. Confusing correlation with causation. Explanation. Option B is correct because the manager observed two trends occurring simultaneously on a dashboard and incorrectly concluded that one caused the other, which is a classic error of confusing correlation with causation. Option A is incorrect because the analytical error is not about neglecting financial data, but about improperly inferring a causal relationship between two observed trends without conducting any deeper analysis to verify actual underlying causes. Option C is incorrect because SMART criteria relate to selecting specific, measurable, attainable, relevant, and time-bound indicators, and the error involves drawing incorrect causal conclusions from data rather than choosing poor metrics. Option D is incorrect because the performance indicators themselves were appropriate for tracking both safety and on-time performance. The fundamental error was in how the manager interpreted the relationship between those two metrics. A rail company's general manager sees safety metrics improving while on-time performance declines on a dashboard. The manager concludes that safety procedures must be causing the delays That's a textbook analytical error, confusing correlation with causation. Just because two trends happen at the same time doesn't mean one caused the other. Maybe the delays are caused by equipment failures, weather, or staffing shortages. Maybe it's pure coincidence. A dashboard shows you what's happening. It doesn't tell you why. Drawing causal conclusions from correlated trends without deeper investigation is one of the most common mistakes people make with data. Ignoring the financial perspective isn't the error here. The problem is about interpreting relationships between metrics. Smart criteria relate to selecting good indicators, not interpreting data trends, and the KPIs chosen were perfectly appropriate. Safety and on-time performance are both valid metrics for a rail company. The error was entirely in how the manager interpreted the relationship. Here's a WGU C214 OA exam tip for you. When a question describes someone observing two simultaneous trends and concluding one caused the other, it's always correlation versus causation. The phrase concluded that X caused Y from dashboard data is your signal. Quick recall hook. Dashboard shows what, not why. Two trends moving together doesn't mean they're connected. 20. A consulting firm recommends that a hospital create a strategy map linking its mission statement to specific actions and measurable outcomes across financial, customer internal process, and learning dimensions. Which critical principle of effective balanced scorecard implementation does this recommendation best represent? A. Limiting the total number of measures used. B. Using only financial targets for evaluation. C. Reflecting company strategy set by leadership. D. Comparing actual results to competitor benchmarks. What do you think is the answer? Correct answer, C. Reflecting company strategy set by leadership. Explanation. Option C is correct because a successful balanced scorecard should reflect the company strategy outlined by top management, and a strategy map linking mission to measurable outcomes across all dimensions exemplifies this principle. Option A is incorrect because while limiting performance measures to focus on crucial objectives is important, the scenario focuses on linking overall strategy to measurable outcomes through a strategy map. Option B is incorrect because the balanced scorecard explicitly requires a balanced mix of financial and non-financial measures, not just financial targets. Option D is incorrect because the balanced scorecard compares actual performance to internal targets for calculating variance, not necessarily to competitor benchmarks, and the scenario describes linking strategy to internal measurement dimensions. Last one in this set. A consulting firm tells a hospital to create a strategy map that links its mission statement to specific actions and measurable outcomes across financial, customer internal process, and learning dimensions. Which BSc implementation principle does this represent? Reflecting company strategy set by leadership. A successful balanced scorecard has to be built on the organization's actual strategy. A strategy map is the tool that makes this visible. It draws the connections from the mission at the top all the way down to measurable outcomes in each of the four perspectives. Without that strategic foundation, a BSc is just a collection of random metrics. Limiting the total number of measures is a valid BSc principle, but the scenario describes linking strategy to outcomes, not reducing metric count. Using only financial targets directly contradicts the BSc. The whole point is balancing financial with non-financial measures, and comparing results to competitor benchmarks isn't how the BSc works. It compares actual performance to internal targets. Here's a WGU C214 OA exam tip for you. When a question mentions a strategy map linking mission to outcomes across all four perspectives, the principle is reflecting company strategy. The strategy map is the visual proof that the BSc is strategy-driven. Quick recall hook. Strategy map equals strategy first BSc. Mission at the top, metrics flow down. 21. A company wants to measure the strength of its customer relationships by asking a single survey question about whether customers would recommend its products to others. Responses are categorized into promoters, passives, and detractors. Which specific performance measurement tool uses this exact methodology to quantify customer loyalty? A. Net Promoter Score Measurement System. B. Balanced Scorecard Customer Perspective. C. Key Performance Indicator Dashboard. D. Customer Satisfaction Composite Index. Can you guess the answer? Correct answer, A. Net Promoter Score Measurement System. Explanation. Option A is correct because the Net Promoter Score specifically categorizes customers into promoters, passives, and detractors based on the recommendation question, using exactly the methodology described in the question scenario. Option B is incorrect because the Balanced Scorecard Customer Perspective includes multiple measures like market share, retention, and satisfaction, but it is a broad framework and not the specific single question methodology described. Option C is incorrect because a KPI dashboard is a visualization tool displaying various performance indicators together, not a specific measurement methodology that categorizes customer survey responses into 3 named distinct groups. Option D is incorrect because a composite index combines multiple data points with weights to create an aggregated measure, while the scenario describes a specific single question survey methodology with 3 distinct customer loyalty categories. Last one in this set. A consulting firm tells a hospital to create a strategy map that links its mission statement to specific actions and measurable outcomes across financial, customer internal process, and learning dimensions. Which BSc implementation principle does this represent? Reflecting company strategy set by leadership. A successful balanced scorecard has to be built on the organization's actual strategy. A strategy map is the tool that makes this visible. It draws the connections from the mission at the top all the way down to measurable outcomes in each of the 4 perspectives. Without that strategic foundation, a BSc is just a collection of random metrics. Limiting the total number of measures is a valid BSc principle, but the scenario describes linking strategy to outcomes, not reducing metric count. Using only financial targets directly contradicts the BSc. The whole point is balancing financial with non-financial measures, and comparing results to competitor benchmarks isn't how the BSc works. It compares actual performance to internal targets. Here's a WGU C214 OA exam tip for you. When a question mentions a strategy map linking mission to outcomes across all 4 perspectives, the principle is reflecting company strategy. The strategy map is the visual proof that the BSc is strategy-driven. Quick recall hook. Strategy map equals strategy first BSc. Mission at the top, metrics flow down. 22. Research has shown that when customers say they intend to recommend a brand, their actual behaviour often differs significantly from that stated intention. Which fundamental limitation of the Net Promoter Score does this finding most directly challenge regarding what the metric truly captures about customer behaviour? A. The scoring scale is not predictive. B. It requires willing survey respondents. C. It cannot identify dissatisfaction areas. D. It measures intention, not actual action. Can you guess the answer? Correct answer, D. It measures intention, not actual action. Explanation. Option D is correct because research confirmed that human intention regarding promoting a brand differs significantly from actual action, meaning the Net Promoter Score captures stated customer intentions rather than real behaviours. Option A is incorrect because debates about scoring scale predictiveness concern the measurement methodology itself, not the fundamental gap between what customers say they intend to do and what they actually do in real practice. Option B is incorrect because requiring willing respondents is a separate logistical limitation of the Net Promoter Score that does not address the fundamental gap between customer stated intentions and their actual recommendation behaviours. Option C is incorrect because inability to identify specific dissatisfaction areas is a different recognised disadvantage of the NPS, which is entirely unrelated to the research finding about the disconnect between intention and actual action. This question targets a fundamental weakness of the Net Promoter Score that research has confirmed. When customers say they intend to recommend a brand, their actual behaviour often looks nothing like that stated intention. Someone might rate you a 9 and then never actually tell a friend about you. The NPS captures what people say they'll do, not what they actually do. That gap between intention and action is the limitation being tested. The scoring scale debate, whether the 0 to 10 scale is the best predictor, is a separate methodological concern. It's about the tool's design, not the intention versus action gap. Requiring willing respondents is a logistical problem about participation rates, and the inability to identify specific dissatisfaction areas is a different NPS weakness entirely. That's about the survey lacking diagnostic detail, not about whether intentions predict behaviour. Here's a WGU C214 OA exam tip for you. When a question mentions research showing that stated intentions differ from actual behaviour, the NPS limitation is that it measures intention, not action. The word intention versus action is your separator. Quick recall hook. NPS captures the promise, not the follow-through. Saying and doing are different things. 23. A company calculates its Net Promoter Score and discovers it falls below the industry average. Management decides to invest in improving customer experience rather than marketing to new customers. Which reasoning best explains why a below-average score would lead to prioritizing existing customer relationships? A. Marketing always costs more than retention. B. Low scores signal weak customer relationships. C. Industry averages are unreliable benchmarks. D. New customers are harder to survey accurately. What do you think is the answer? Correct answer. B. Low scores signal weak customer relationships. Explanation. Option B is correct because a Net Promoter Score below industry average indicates customer relationships are weaker than competitors, making it logical to strengthen existing relationships before trying to attract entirely new customers. Option A is incorrect because the reasoning for prioritizing customer experience comes from the diagnostic signal of a below-average Net Promoter Score, indicating relationship weakness, not from any general cost comparisons between strategies. Option C is incorrect because industry averages serve as legitimate benchmarks, allowing companies to compare customer loyalty performance against competitors, and the Net Promoter Score is specifically designed for such benchmarking comparisons. Option D is incorrect because difficulty surveying new customers is not a factor in this decision. The choice is driven by the below-average score, indicating current customer loyalty needs strengthening before pursuing new customer acquisition. A company runs an NPS survey and discovers its score falls below the industry average. Management decides to invest in improving customer experience instead of chasing new customers. Why? Because a below-average score signals that existing customer relationships are weaker than the competition's. If your current customers aren't loyal enough to recommend you, pouring money into acquiring new customers is like filling a leaky bucket. Fix the leak first. The NPS serves as a diagnostic signal here. It's telling management where the problem lives. Option A says marketing always costs more than retention. That might be true in many cases, but it's not why the company made this specific decision. The decision came from reading the NPS signal, not from a generic cost comparison. Option C claims industry averages are unreliable benchmarks, but that contradicts the whole point of the NPS. It's specifically designed for cross-company benchmarking. And option D about surveying new customers being harder has nothing to do with the strategic decision being made. Here's a WGU C214 OA exam tip for you. When a question links a below-average NPS to a strategic shift toward existing customers, the reasoning is that low scores signal weak relationships. The NPS is the diagnostic, the strategy follows. Quick recall hook. Low NPS equals leaky bucket. Fix existing relationships before adding new ones. 24. A hotel chain implements the Net Promoter Score system and receives many low ratings from guests, but the survey data cannot reveal whether dissatisfaction stems from room quality, staff interactions, pricing, or location. Which recognized disadvantage of the Net Promoter Score does this limitation demonstrate? A. Scores fail to predict loyalty behaviors. B. The scoring scale lacks predictive power. C. Difficulty capturing precise dissatisfaction areas. D. Requiring customers willing to respond. Do you know the answer? Correct answer, C. Difficulty capturing precise dissatisfaction areas. Explanation. Option C is correct because a recognized NPS disadvantage is difficulty capturing the precise area of dissatisfaction, which is exactly the problem when low ratings cannot reveal the specific underlying causes of customer unhappiness. Option A is incorrect because failure to predict loyalty behaviors is a separate criticism related to whether stated intentions translate into actual actions, not about identifying the specific underlying source of customer dissatisfaction from data. Option B is incorrect because debates about whether the 11-point scale is optimally predictive concern the measurement methodology, not the practical inability to determine which specific aspect of the service caused customer dissatisfaction. Option D is incorrect because requiring willing respondents is a logistical limitation about survey participation rates, and the scenario describes a situation where customers did respond but their specific underlying concerns remained entirely unclear. A hotel chain gets a bunch of low NPS ratings from guests, but the survey can't tell them why. Is it the rooms, the staff, the pricing, the location? Nobody knows because the NPS is a single question that produces a single number. It doesn't dig into specifics. That's the recognized disadvantage being tested. Difficulty capturing the precise area of dissatisfaction. The NPS tells you that customers are unhappy. It doesn't tell you what made them unhappy. You need follow-up research for that. Failure to predict loyalty behaviors is a different criticism. That's the intention versus action gap we just covered. The scoring scale debate is about whether the 11-point scale is the best way to measure, not about diagnostic capability. And requiring willing respondents is a logistical issue about getting people to actually take the survey. In this scenario, people did respond. The problem is that their responses lack diagnostic depth. Here's a WGU C214 OA exam tip for you. When a question describes an organisation getting low scores but not knowing the specific cause, the NPS disadvantage is difficulty capturing precise dissatisfaction areas. The phrase "can't tell which aspect" is your cue. Quick recall hook: NPS tells the what, not the where. Low score? You know something's wrong. You just don't know what. 25. A company conducts a Net Promoter Score survey and categorizes respondents who gave 9 or 10 as one group, 7 or 8 as another, and 0 through 6 as a third group. What are the correct category names assigned to these three groups in the established methodology? A. Promoters, passives, and detractors. B. Supporters, neutrals, and opponents. C. Advocates, undecided, and critics. D. Champions, moderates, and complainers. What do you think is the answer? Correct answer: A. Promoters, passives, and detractors. Explanation. Option A is correct, because the Net Promoter Score methodology specifically names customers rating 9 or 10 as promoters, 7 or 8 as passives, and 0 through 6 as detractors in its established system. Option B is incorrect because supporters, neutrals, and opponents are not official category names used in the Net Promoter Score system, developed by Reichheld, Bain and Company, and SAP Metrics for customer loyalty measurement. Option C is incorrect because advocates, undecided, and critics are not the established terminology of the Net Promoter Score framework, which uses its own specific naming convention for the 3 distinct customer groups it identifies. Option D is incorrect because champions, moderates, and complainers are not recognized terms within the Net Promoter Score methodology, which exclusively categorizes customers as promoters, passives, or detractors based on their ratings. This is a straight definition recall question, but getting these category names and score ranges locked in matters because they pop up inside harder questions. The NPS uses an 11-point scale from 0 to 10. Customers who score 9 or 10 are promoters. They're your enthusiastic advocates. Customers who score 7 or 8 are passives. Satisfied, but not energized enough to spread the word. Customers who score 0 through 6 are detractors. They're unhappy and potentially damaging your reputation. Those are the exact established terms: promoters, passives, and detractors. The other options use similar sounding words: supporters and neutrals, advocates and critics, champions and complainers. But none of them are the official NPS terminology. The exam tests whether you know the precise language. Here's a WGU C214 OA exam tip for you. Memorize the 3 NPS categories and their exact score ranges. Promoters are 9 to 10, passives are 7 to 8. Detractors are 0 through 6. The names and numbers are what the exam cares about. Quick recall hook. PPD 970. Promoters at the top, passives in the middle, detractors at the bottom. 26. A business manager wants to understand how the price of a single product has changed compared to a starting period she selected as a reference point. In business analytics, what is the correct term for this reference starting point that all future price measurements are compared against? A. Composite period for multiple goods. B. Weighted average time frame. C. Forecasted projection baseline. D. Base period for initial comparison. Can you guess the answer? Correct answer, D. Base period for initial comparison. Explanation. Option D is correct because the base period is the first time a researcher selects as a reference point, and all subsequent index measurements are compared against it to track changes over time. Option A is incorrect because composite period is not a recognized term in index number methodology. The reference point used for all comparisons when tracking price changes over time is specifically called the base period. Option B is incorrect because weighted average time frame is not the term for the initial reference point in index analysis. The correct and established term is base period, serving as the starting comparison. Option C is incorrect because a forecasted projection baseline refers to estimated future values, not the actual historical reference point a researcher selects to compare all subsequent price or quantity changes against. Now we're moving into index numbers, which is a different branch of business analytics. A manager wants to understand how the price of a single product changed over time compared to a starting reference point. That starting reference point has a specific name: the base period. The base period is the first time point a researcher selects, and every future measurement gets compared back to it. If you set your base period as January and the price was $100, then every month after that gets compared against that $100 starting line. It's the anchor for the whole analysis. Composite period isn't a recognized term in index methodology. Weighted average time frame sounds technical, but doesn't describe a reference starting point. And forecasted projection baseline is about estimated future values, not the actual historical point you're comparing against. Here's a WGU C214 OA exam tip for you. When a question says reference point, starting point for comparison, or first time selected, the answer is base period. It's the anchor for all index calculations. Quick recall hook. Base period equals starting line. Everything gets measured from there. 27. A researcher compares prices of several different goods over time, but wants goods with larger quantities or higher prices to have proportionally greater influence on the final result than smaller goods. Which type of index achieves this proportional representation in its calculations? A. Simple index for a single good. B. Simple composite index equally weighted. C. Weighted composite index for proportional influence. D. Base period index without adjustments. Do you know the answer? Correct answer. C. Weighted composite index for proportional influence. Explanation. Option C is correct because a weighted composite index applies more weight to certain goods based on quantity, sizes, or prices, providing a proportional understanding that better reflects actual changes occurring over time. Option A is incorrect because a simple index tracks only one single good or service over time and cannot incorporate multiple goods with differing levels of influence on the final calculated overall result. Option B is incorrect because a simple composite index gathers data from many sources without weighing any data more significantly than others, meaning all goods have equal influence regardless of their actual size. Option D is incorrect because base period index is not a recognized index type. The base period is simply the reference starting point used across all types of indexes rather than a distinct methodology. Staying with index numbers, a researcher compares prices of several goods over time and wants goods with larger quantities or higher prices to carry more weight in the final result. That's a weighted composite index. The word weighted means some items count more than others based on their relative importance, quantity sold, price level, or market share. A simple index only tracks one single good, so it can't handle multiple goods with different levels of influence. A simple composite index gathers data from many goods, but treats them all equally. No item gets more influence than another. And base period index isn't even a type of index. The base period is just the reference starting point used across all index types. Here's a WGU C214 OA exam tip for you. When a question mentions proportionally greater influence, more weight to some goods, or not all items treated equally, that's a weighted composite index. The word proportional is the key. Quick recall hook. Weighted means not equal. Bigger items get a bigger say in the final number. 28. The Consumer Price Index tracks a defined collection of assorted consumer goods and services purchased by a common household over time, and is among the most closely watched statistics across all business sectors. What is the primary significance of this index for understanding the economy? A. It serves as the main inflation measure. B. It tracks individual company revenues. C. It measures unemployment rates directly. D. It predicts future stock market trends. Do you know the answer? Correct answer. A. It serves as the main inflation measure. Explanation. Option A is correct because the Consumer Price Index is significant, specifically because it serves as the main measure of inflation for a country, showing how the overall economy has changed over time. Option B is incorrect because the Consumer Price Index tracks price changes for a defined basket of household consumer goods and services across the economy, not the revenue performance of any individual business. Option C is incorrect because the Consumer Price Index measures price changes of consumer goods over time, not employment statistics. Unemployment is measured by entirely separate labour market indicators and government surveys. Option D is incorrect because the Consumer Price Index is a backward-looking measure of how prices have already changed, not a predictive tool designed for forecasting future movements in the stock market. The Consumer Price Index, the CPI, is one of those terms that shows up in business, economics, and policy discussions constantly. It tracks a defined basket of consumer goods and services that a typical household buys over time: groceries, housing, transportation, medical care, the everyday stuff. The reason it matters so much is that the CPI serves as the main measure of inflation for a country. When the CPI goes up, it means the cost of living is rising. When people say inflation is at 3%, they're usually referencing the CPI. It doesn't track individual company revenues. That's what financial statements do. It doesn't measure unemployment. That's a labour market indicator from different surveys. And it doesn't predict stock market trends. It's backward-looking, telling you how prices already changed, not where they're going. Here's a WGU C214 OA exam tip for you. CPI equals inflation. If a question describes a basket of household goods tracked over time and asks about its significance, the answer is inflation measurement. Quick recall hook. CPI equals cost of living price increase. It measures how expensive life is getting. 29. One common type of weighted index is known to slightly exaggerate inflation because it compares the same fixed quantity of goods over time without accounting for how consumers change their purchasing behaviour when prices rise. Which specific index has this limitation? A. Parsh index adjusting for quantities. B. Last Peers index using fixed base quantities. C. Simple composite index with equal weights. D. Consumer price index tracking all goods. What do you think is the answer? Correct answer. B. Last Peers index using fixed base quantities. Explanation. Option B is correct because the Last Peers index compares the same fixed quantity of goods over time, and it often slightly exaggerates inflation since it ignores consumer reactions to changing prices. Option A is incorrect because the Parsh index uses the quantities actually purchased at each time period, reflecting real consumer behaviour and therefore tending to understate inflation rather than exaggerating it. Option C is incorrect because a simple composite index weighs all data equally without applying different weights to any goods, making it fundamentally different from the weighted approach, producing the exaggeration described. Option D is incorrect because while the consumer price index follows a Last Peers style approach, the question asks about the specific named index type, known for the recognised limitation of exaggerating inflation. Here's where students need to know the difference between Last Peers and Parsh indexes. The question describes an index that slightly exaggerates inflation because it holds quantities fixed at the base period and ignores how consumers actually change their buying habits when prices go up. That's the Last Peers index. The logic: if the price of beef doubles, consumers buy less beef and more chicken. But the Last Peers index keeps using the original beef quantity, so it overestimates how much people are actually spending. That's the exaggeration. The Parsh index does the opposite. It uses current period quantities, which reflects real purchasing behaviour. Because consumers substitute cheaper goods, the Parsh index tends to understate inflation. A simple composite index treats everything equally without any weighting at all, so the exaggeration concept doesn't apply the same way. And while the CPI does follow a Last Peers style approach, the question asks about the specific name index type with this limitation. Here's a WGU C214 OA exam tip for you. Last Peers uses fixed base quantities and exaggerates inflation. Parsh uses current quantities and understates inflation. If you remember which one fixes and which one updates, you've got both nailed. Quick recall hook. Last Peers is locked in the past. Fixed quantities, inflation exaggerated. 30. When a researcher gathers price data from multiple sources for a single good and calculates an index without giving any one source more importance than another, all information receives equal significance in the result. What type of composite index does this equal treatment represent? A. Weighted composite index with proportions. B. Last Peers index using fixed quantities. C. Simple composite index with equal weights. D. Parsh index using current quantities. Do you know the answer? Correct answer: C. Simple composite index with equal weights. Explanation. Option C is correct because a simple composite index is created when a researcher gathers data from many sources without weighing any data more significantly than others, treating all information with equal significance. Option A is incorrect because a weighted composite index specifically applies more weight to certain goods or services based on quantity or price, which directly contradicts the equal treatment of all data sources described here. Option B is incorrect because the Laspers index is a specific weighted composite index holding base, period quantities constant, applying differential weights rather than treating all data sources with equal significance. Option D is incorrect because the Parsh index is another weighted composite index using quantities from the current period, incorporating differential weighting rather than the equal treatment of all data sources described. This question is the simpler cousin of the weighted composite index. A researcher gathers price data from multiple sources and calculates an index without giving any source more importance than another. Everything counts equally. That's a simple composite index. The word simple here means no weighting. Every data point carries the same influence in the final result, regardless of how big or small the underlying good is. A weighted composite index is the opposite. It deliberately gives more influence to certain goods based on quantity or price. The Laspers index is a specific type of weighted index that holds base period quantities constant. The Parsh index is another weighted type using current period quantities. Both apply differential weights, which directly contradicts the equal treatment described in the question. Here's a WGU C214 OA exam tip for you. Equal treatment, no source more important, and same significance all point to the simple composite index. The moment you see weighted or proportional, you're in weighted territory instead. Quick recall hook. Simple means same. Every item gets one vote. 31. A licensing board designs an exam where candidates must answer a minimum number of questions correctly to earn certification, regardless of how other candidates perform on that same exam. Which type of test compares individuals against a fixed defined standard rather than against other test takers? A. Norm reference test comparing to peers. B. Standard score using Z-score methods. C. Item response theory, adaptive model. D. Criterion reference test against standards. Do you know the answer? Correct answer, D. Criterion reference test against standards. Explanation. Option D is correct because criterion reference tests compare an individual to certain defined standards, such as answering a required number of questions correctly, regardless of how other test takers actually performed. Option A is incorrect because norm reference tests compare an individual to other individuals taking the same test, using relative standing among peers rather than measuring performance against any fixed predetermined passing standard. Option B is incorrect because a standard score is a statistical calculation measuring distance from the mean in standard deviations, which is a norm-referenced measurement technique rather than a type of test. Option C is incorrect because item response theory is a model for designing, analysing, and scoring tests, focusing on individual question difficulty, not a test type defined by comparing individuals against fixed standards. Shifting to assessment and testing concepts now. A licensing board designs an exam where candidates must answer a minimum number of questions correctly to pass, regardless of how anyone else performs. It doesn't matter if every other candidate scored higher or lower. Your result is measured against a fixed standard. That's a criterion reference test. The word criterion means a predetermined standard or benchmark. You either meet it or you don't. Norm reference tests work differently. They compare you to other test takers. Your score means something only relative to the group. Grading on a curve is a norm-referenced approach. Standard scores using Z-score methods are a statistical calculation showing how far you are from the mean, which is another norm-referenced technique. An item response theory is a model for analysing individual question difficulty and designing adaptive tests. It's not a test type defined by comparison against fixed standards. Here's a WGU C214 OA exam tip for you. Fixed standard, minimum score to pass, or, regardless of others, always means criterion referenced. If the comparison is against people, it's norm referenced. If it's against a standard, it's criterion referenced. Quick recall hook. Criterion equals cutoff. Meet the bar or don't. Other people don't matter. 32. A student performs unusually poorly on an exam because she was ill that day, but under normal conditions she would have scored much higher. In classical test theory, what is the term for the score she would theoretically achieve if she could take the test infinite times? A. True score from infinite test attempts. B. Observed score from actual test taking. C. Composite score combining all questions. D. Reliability index for test consistency. Can you guess the answer? Correct answer, A. True score from infinite test attempts. Explanation. Option A is correct, because a true score is defined as the average score an individual would achieve if they took the test infinite times, representing their actual underlying ability level without random interference. Option B is incorrect because the observed score is the score actually achieved by an individual on a single test administration, which may be influenced by random factors like illness and may differ from true ability. Option C is incorrect because a composite score combines results of equally weighted questions into one total, but it does not represent the theoretical average that would emerge from an infinite number of test administrations. Option D is incorrect because a reliability index measures how well an observed score represents a true score across test administrations, but it is not itself the theoretical score from infinite test attempts. Classical test theory gives us a specific concept for the score someone would theoretically achieve if they could take the same test an infinite number of times. That's the true score. In this scenario, a student performs poorly because she's sick. On any other day, she'd score much higher. The observed score, what she actually got that day, was dragged down by a random factor, but if she took that test over and over again, the random highs and lows would average out, and what's left is her true score. It represents actual underlying ability without random noise. The observed score is what actually happened on one specific test day. It's real, but it may not reflect true ability. A composite score combines individual question results into one total. That's about scoring method, not the theoretical construct of infinite attempts. And a reliability index measures how well an observed score represents a true score, but it's a measurement of accuracy, not the score itself. Here's a WGU C214 OA exam tip for you. When a question mentions infinite test attempts, average over unlimited administrations, or actual ability without random interference, the answer is true score. Infinite is the trigger word. Quick recall hook. True score equals the infinite average. Take the test forever, and what remains is the truth. 33. A student consistently scores poorly on science exams, not because of a lack of knowledge, but because the tests are written in a language the student does not understand, creating a persistent barrier unrelated to the subject. What type of measurement error does this illustrate? A. Random error from chance situations. B. Observed score deviation from mean. C. Systematic error from unrelated factors. D. True score variation across forms. Can you guess the answer? Correct answer. C. Systematic error from unrelated factors. Explanation. Option C is correct because systematic measurement errors occur when something entirely unrelated to the test content consistently affects results, such as a language barrier repeatedly preventing accurate knowledge measurement. Option A is incorrect because random measurement error results from chance, coincidental situations that eventually cancel out over many tests, whereas the described language barrier consistently impacts every single test administration. Option B is incorrect because observed score deviation from mean is not a recognized category of measurement error in classical test theory. The two recognized types are specifically random error and systematic error. Option D is incorrect because true score variation across forms is not a recognized type of measurement error. The scenario describes a systematic barrier that consistently distorts the observed score away from actual ability. A student keeps scoring poorly on science exams, not because she doesn't know science, but because the tests are written in a language she doesn't understand. The barrier is consistent. It happens every single time. And it's completely unrelated to what the test is supposed to measure. That's systematic error. In classical test theory, there are two types of measurement error. Random error comes from chance situations. You had a bad night's sleep. You guessed lucky on 3 questions. There was noise outside. These factors are unpredictable and tend to cancel out over many tests. Systematic error is the opposite. It's a persistent, consistent bias caused by something unrelated to the test content. The language barrier doesn't cancel out. It drags the score down every single time. Observed score deviation from mean isn't a recognized error category in classical test theory. And true score variation across forms isn't either. The two recognized types are random and systematic. That's it. Here's a WGU C214 OA exam tip for you. Consistent bias from an unrelated factor equals systematic error. Random chance that cancels out over time equals random error. Consistency is the dividing line. Quick recall hook. Systematic equals same problem every time. If it keeps happening and it's not about the subject, it's systematic. 34. A testing organization wants to extract maximum information from each individual question, rather than treating all questions as equally difficult. This approach examines what a correct answer on each question implies about ability on different scales. Which testing model uses this methodology? A. Classical test theory with equal weighting. B. Item response theory. Analyzing each question. C. Split half method for internal consistency. D. Test-retest method comparing administrations. Correct answer. B. Item response theory, analysing each question. Explanation. Option B is correct because item response theory does not assume equal question difficulty and focuses on each question's implications. Can you guess the answer? Of a correct answer on different scales, extracting maximum information from every response. Option A is incorrect because classical test theory looks at the overall test's implications on each individual question rather than examining what each question individually reveals and typically treats all questions equally. Option C is incorrect because the split half method measures internal consistency by splitting a test into halves and comparing correlations, which is a reliability technique, not a model for analysing individual question difficulty. Option D is incorrect because the test-retest method gives the same test on 2 occasions to measure reliability over time and does not involve analysing the implications of correct answers on individual questions. This question is about the difference between classical test theory and item response theory, 2 fundamentally different approaches to testing. Item response theory, or IRT, doesn't assume all questions are equally difficult. It zooms in on each individual question and asks, what does getting this question right actually tell us about the test taker's ability? Different questions reveal different things at different ability levels. That's how IRT extracts maximum information from each response. Classical test theory takes the opposite approach. It looks at the overall test and works backward to understand individual questions. It tends to treat all questions with equal weight. The split half method is a reliability technique where you divide one test into 2 halves and compare them. And the test-retest method gives the same test twice to check consistency over time. Neither of those analyses what individual questions imply about ability on different scales. Here's a WGU C214 OA exam tip for you. Maximum information from each question, not equally difficult, and implications of correct answers on different scales. All point to item response theory. IRT is question-focused. Classical test theory is test-focused. Quick recall hook. IRT equals individual question deep dive. Each question gets its own analysis. 35. A state education department receives complaints that a standardized math test was unreliable and administers a completely new test covering the same content to the same students. Which recognized method of measuring test reliability does this approach of giving an equivalent but different test represent? A. Split half method dividing one test. B. Cronbach's alpha averaging all splits. C. Test retest giving identical test again. D. Parallel forms using equivalent new test. Do you know the answer? Correct answer. D. Parallel forms using equivalent new test. Explanation. Option D is correct because the parallel forms method involves two tests made in the exact same way given to the same sample, which is precisely what administering an equivalent new test to the same students represents. Option A is incorrect because the split half method divides a single test into two halves and measures the correlation between them, rather than creating and administering an entirely separate equivalent test to the same group. Option B is incorrect because Cronbach's alpha takes the average of all possible split half variations within a single sample, and it does not involve administering any additional tests to the same group of students. Option C is incorrect because the test-retest method gives the identical same test on two different occasions, whereas the scenario specifically describes creating a completely new but equivalent test covering the identical content. A state education department gets complaints about test reliability and decides to create a completely new test covering the same content, then gives it to the same students. That's the parallel forms method of measuring reliability. Parallel forms means two different tests built the same way, covering the same material, given to the same group. If both tests produce similar results, the measurement is reliable. The split half method is different. It takes one single test and splits it into two halves to see if the halves correlate. No new test is created. Cronbach's alpha is a statistical extension of the split half idea. It averages all possible ways to split one test into halves. Again, one test, no second version. And test-retest gives the exact same test again on a different day. The scenario specifically says a completely new test that rules out test-retest, which reuses the identical exam. Here's a WGU C214 OA exam tip for you. New but equivalent test plus same students equals parallel forms. If they give the identical test again, that's test-retest. The word new versus identical is your separator. Quick recall hook. Parallel equals two different tests, same blueprint. New test, same content, same people. 36. A government agency needs to decide which infrastructure projects should receive limited public funding by comparing each project's total expenses against the measurable benefits it would deliver to citizens. Which analytical technique, originally developed in the public sector, is most appropriate for this prioritization? A. Net Promoter Score for public opinion. B. Balanced scorecard for organizational goals. C. Cost-benefit analysis for project prioritization. D. Key performance indicator dashboard review. Do you know the answer? Correct answer. C. Cost-benefit analysis for project prioritization. Explanation. Option C is correct because cost-benefit analysis is a technique that began in the public sector and is used by government agencies to compare project costs against benefits when determining which projects deserve funding. Option A is incorrect because the Net Promoter Score measures customer loyalty through survey responses about recommendation likelihood, and it is not designed for comparing costs against benefits of government infrastructure projects. Option B is incorrect because the balanced scorecard measures organisational performance across 4 perspectives and is not specifically a tool for comparing costs against benefits of competing projects to prioritise limited funding. Option D is incorrect because a key performance indicator dashboard displays ongoing performance metrics visually, but it is not an analytical technique for comparing project costs against benefits to prioritise among competing proposals. A government agency needs to pick which infrastructure projects get limited public funding by comparing each project's total costs against the measurable benefits it delivers to citizens. That's cost-benefit analysis. And here's a detail that makes it even more exam relevant. Cost-benefit analysis originally started in the public sector. Government agencies were the first to formalise the practice of weighing project costs against public benefits. The Net Promoter Score measures customer loyalty through surveys. It has nothing to do with comparing project costs against infrastructure benefits. The balanced scorecard tracks organisational performance across 4 perspectives, but it's not built for the specific task of ranking competing projects by their cost-to-benefit ratio. And a KPI dashboard displays ongoing metrics visually without providing the analytical comparison of costs versus benefits needed for project prioritisation. Here's a WGUC 214 OA exam tip for you. Costs versus benefits, which project deserves funding, and government prioritisation are all cost-benefit analysis signals. Remember that it began in the public sector. That's a bonus fact that shows up on exams. Quick recall hook. CBA equals costs before approval. Compare costs to benefits before you approve the spending. 37. In public sector projects, benefits often cannot be measured in traditional financial terms because many government initiatives produce value through improved public welfare rather than direct revenue. How does this make public sector cost-benefit analysis fundamentally different from the private sector approach to the same technique? A. Government must measure public welfare benefits. B. Private sector ignores all non-financial factors. C. Government projects always generate direct revenue. D. Private sector uses only qualitative assessments. Can you guess the answer? Correct answer, A. Government must measure public welfare benefits. Explanation: Option A is correct, because public sector cost-benefit analysis must evaluate whether projects benefit the general welfare of the population enough to justify costs, even when projects generate no obvious direct revenue. Option B is incorrect because private sector analysis does consider non-financial factors in various contexts. The key distinction is that public sector projects often lack direct revenue and must justify costs through welfare benefits. Option C is incorrect because many government projects generate no obvious money at all, yet they can still be prioritised and funded based on their demonstrated benefit to the general welfare of the population being served. Option D is incorrect because the private sector extensively uses quantitative measures, including revenue and profit margins. The distinction is about what types of benefits must be measured in each sector, not measurement style. This question gets at the key difference between public and private sector cost-benefit analysis. Private companies can usually measure benefits in dollars: revenue gained, cost saved, profit earned. Governments often can't do that because their projects produce public welfare benefits that don't generate direct money. A new bridge might save commuters' time. A vaccination program might prevent disease. A public park might improve mental health. None of these produce revenue in the traditional sense, but they all benefit the population. So government cost-benefit analysis has to figure out whether projects benefit the general welfare enough to justify the expense, even with no revenue in sight. Option B claims private sector ignores all non-financial factors, which isn't true. Private companies consider non-financial factors too. Option C says government projects always generate direct revenue, which is exactly backwards. And option D says the private sector uses only qualitative assessments, which is also wrong. Private sector analysis is heavily quantitative. Here's a WGU C214 OA exam tip for you. Public sector CBA differs because benefits are measured in public welfare, not revenue. When a question asks how government analysis is unique, the answer is welfare-based benefit measurement. Quick recall hook. Government CBA equals welfare, not wealth. Benefits are measured in public good, not profit. 38. A military organisation needs to evaluate multiple approaches for achieving a specific operational objective, but finds that traditional cost-benefit analysis is impractical because benefits cannot be easily expressed in monetary terms. Which alternative analytical approach compares costs of different strategies for achieving one quantifiable goal? A. Balanced scorecard with 4 perspectives. B. Net promoter, score for satisfaction levels. C. Key performance indicator trend analysis. D. Cost effectiveness analysis, comparing approaches. What do you think is the answer? Correct answer. D. Cost effectiveness analysis, comparing approaches. Explanation. Option D is correct because cost effectiveness analysis determines a quantifiable goal first, then analyzes the cost of achieving that predetermined goal across multiple courses of action to guide decision-making in contexts like military. Option A is incorrect because the balanced scorecard measures organizational performance across 4 balanced perspectives and is not specifically designed for comparing costs of multiple approaches to achieve one single predetermined goal. Option B is incorrect because the Net Promoter Score measures customer loyalty through a single survey question about recommendations, and it has no relevance to comparing costs of different military strategies for operational objectives. Option C is incorrect because key performance indicator trend analysis tracks how metrics change over time to monitor ongoing performance, not to compare the costs of multiple different approaches for achieving one specific goal. A military organisation can't use traditional cost-benefit analysis because the benefits of its operations aren't easily expressed in monetary terms. How do you put a dollar value on achieving a security objective? You don't. Instead, you use cost-effectiveness analysis. Cost-effectiveness analysis works differently from cost-benefit analysis. You start by defining one specific quantifiable goal, the objective you're trying to achieve. Then you compare the costs of different approaches to reaching that same goal. Which strategy gets us there for the least money? That's the question cost-effectiveness analysis answers. The balanced scorecard measures organizational performance across 4 perspectives, not designed for comparing costs of military strategies. NPS measures customer satisfaction through surveys, completely irrelevant to military operational analysis. And KPI trend analysis tracks metrics over time, which doesn't compare costs of different approaches to a single goal. Here's a WGU C214 OA exam tip for you. When benefits can't be measured in money, and the question asks about comparing costs of different strategies for one goal, it's cost-effectiveness analysis. The phrase benefits can't be expressed in monetary terms is your signal to shift from CBA to CA. Quick recall hook. CA equals cheapest path to the same goal. Same destination, different price tags. 39. Unlike private corporations pursuing a relatively unified goal of maximizing revenues, government agencies often face the challenge of serving multiple constituencies whose interests may directly conflict with one another. Why does this create a unique analytical challenge for government data-driven decision-making? A. Government agencies never use analytics. B. Prioritizing some interests is often controversial. C. Private companies face identical challenges. D. Public data is always less reliable. What do you think is the answer? Correct answer. B. Prioritizing some interests is often controversial. Explanation. Option B is correct because in using analytics within the public sector, many different interests must be considered, and the process of prioritizing some groups over others is often politically and socially controversial. Option A is incorrect because government agencies increasingly use analytics for understanding past performance and delivering services more efficiently. The challenge is navigating competing interests, not an absence of analytical capability. Option C is incorrect because private companies generally share a more unified, profit-driven goal, whereas governments must balance fundamentally different and often directly opposing constituency interests when making public decisions. Option D is incorrect because the quality of public data is not inherently less reliable. The unique challenge is about navigating controversial prioritization decisions among groups with competing interests and different needs. Government agencies face something private companies mostly don't: multiple constituencies whose interests directly conflict with each other. A private corporation can rally around maximizing revenue and shareholder value. That's relatively unified, but a government agency serving a city might have homeowners wanting lower taxes, teachers wanting higher school funding, businesses wanting less regulation, and environmentalists wanting stricter protections. These aren't just different preferences, they're competing interests that directly oppose each other. Deciding which group's needs take priority is inherently controversial. That's the unique analytical challenge. Option A says government agencies never use analytics, which is simply wrong. They use analytics extensively. Option C claims private companies face identical challenges, but the private companies generally have a more unified profit-driven goal without the same level of conflicting constituency demands. And option D says public data is always less reliable, which isn't true and isn't the challenge described here. Here's a WGU C214 OA exam tip for you. Conflicting constituencies, competing interests, and controversial prioritization describe the unique challenge of public sector analytics. The controversy comes from choosing winners and losers among the public. Quick recall hook. Government analytics equals competing voices. Everyone wants something different, and someone won't be happy. 40. A state program keeping juvenile offenders in home communities during treatment rather than in expensive detention facilities was evaluated and found that every $1 million spent avoided over $3 million in incarceration costs. What type of analysis was used to justify continuing this program? A. Cost-benefit analysis showing net savings. B. Net promoter score measuring satisfaction. C. Balanced scorecard tracking multiple perspectives. D. Key performance indicator monitoring over time. Do you know the answer? Correct answer: A. Cost-benefit analysis showing net savings. Explanation. Option A is correct, because this is a classic cost-benefit analysis where program costs were compared against the financial savings from avoided incarceration, demonstrating clear economic justification for continuing the program. Option B is incorrect because the Net Promoter Score measures customer loyalty through survey responses about willingness to recommend, and it was not the method used to compare program costs against incarceration savings. Option C is incorrect because the Balanced Scorecard measures organizational performance across 4 perspectives simultaneously, and the scenario describes a straightforward comparison of program costs against measurable financial savings. Option D is incorrect because Key Performance Indicator monitoring tracks ongoing performance metrics over time, whereas the scenario describes a specific analytical comparison of program costs against the financial savings actually achieved. A state program keeps juvenile offenders in home communities instead of detention facilities. An evaluation finds that every $1 million spent avoided over $3 million in incarceration costs. That's cost-benefit analysis in action. You've got a clear cost, the program expense, and a clear benefit, the money saved by not incarcerating. The math is straightforward. spend 1 million, save 3 million. Net savings of 2 million. That's exactly what CBA does. It compares total costs against total benefits and shows whether the investment pays off. The Net Promoter Score measures customer loyalty. It has zero relevance to comparing program costs against incarceration savings. The Balanced Scorecard tracks performance across 4 organizational perspectives, which is a different analytical tool entirely. And KPI monitoring tracks metrics over time, useful for ongoing performance watching, but it's not the specific analytical comparison of costs against financial savings described in this scenario. Here's a WGU C214 OA exam tip for you. When a question describes spending money on a program and then calculating how much was saved compared to the alternative, that's CBA. The pattern is spent X, saved Y. Quick recall hook. CBA equals, did the spending pay off? If the question compares cost against savings, it's cost-benefit analysis. 41. A hospital administrator evaluates care quality by measuring 30-day survival rates, healthcare-associated infections, and doctor-specific mortality rates. According to the American College of Physicians, these types of measurements are developed and used in healthcare specifically to improve the overall performance of which group? A. Individual patients receiving treatment. B. Insurance companies processing claims. C. Healthcare providers delivering services. D. Government regulators writing policy. Do you know the answer? Correct answer, C. Healthcare providers delivering services. Explanation. Option C is correct because healthcare performance measures like survival rates, infections, and mortality rates are developed and used by various groups specifically to improve the overall performance of the healthcare provider. Option A is incorrect because these performance measures evaluate quality of care delivered by the healthcare system, not the individual performance of patients who are receiving treatment and cannot control institutional metrics. Option B is incorrect because insurance companies process claims and manage coverage, but clinical performance measures such as survival rates and infection rates are specifically designed to assess the providers delivering care. Option D is incorrect because while government regulators may use these measures to inform policy, the measures are specifically developed and endorsed to evaluate and improve the performance of the healthcare provider directly. Let's get into healthcare performance measurement. A hospital administrator tracks 30-day survival rates, healthcare-associated infections, and doctor-specific mortality rates. The question asks, according to the American College of Physicians, who are these measures designed to improve? The answer is healthcare providers delivering services. These metrics exist to evaluate how well the hospital, the doctors, and the clinical teams are performing. Survival rates tell you whether patients are living through procedures. Infection rates tell you whether the facility is maintaining safe conditions. Mortality rates by doctor tell you whether individual physicians are meeting standards. All of these point back to provider performance. Patients receiving treatment can't control these institutional metrics. They're the ones being measured on, not measured for. Insurance companies process claims and manage coverage, but clinical outcome measures aren't designed to evaluate their performance. And government regulators might use these numbers to inform policy, but the measures themselves are built to assess and improve the providers directly. Here's a WGU C214 OA exam tip for you. When a question lists clinical metrics like survival rates, infection rates, and mortality rates, and asks whose performance they measure, it's always healthcare providers. The patient receives care. The provider is who gets evaluated. Quick recall hook. Clinical metrics measure the clinic. Survival, infections, mortality, all about the provider. 42. A military organisation has recently shifted its performance measurement focus toward demonstrating fiscal accountability and proving that resources are used to their maximum potential. This shift requires the organisation to use performance measurements specifically for demonstrating which increasingly prioritised objective. A. humanitarian mission outcome tracking. B. Personnel recruitment rate increases. C. Combat readiness level evaluation. D. Maximized utilization of all resources. Do you know the answer? Correct answer. D. Maximized utilization of all resources. Explanation. Option D is correct because the focus has shifted to fiscal accountability, requiring military groups to demonstrate the maximized use of resources through performance measurements of spending habits. Option A is incorrect because while humanitarian values are important, the shift described focuses on fiscal accountability and resource utilization. Option B is incorrect because tracking recruitment is a possible metric, but does not represent the broader shift toward fiscal accountability and proving maximized resource use. Option C is incorrect because while combat readiness is important, the shift focuses on fiscal accountability and demonstrating maximum resource potential. Military organizations have traditionally focused performance measurement on things like combat readiness and mission outcomes, but recently there's been a shift. The focus now includes fiscal accountability, proving that every dollar spent is used to its maximum potential. The question describes this shift, and the answer is maximized utilization of all resources. Military groups are now expected to demonstrate through performance measurements that they aren't wasting money. Humanitarian mission tracking is one example of a military metric, but it doesn't capture the broader fiscal accountability shift described here. Personnel recruitment rates matter for staffing, but that's a narrow HR metric, not the overarching shift toward proving resource efficiency. And combat readiness evaluation is a traditional military concern that predates this fiscal accountability trend. The question specifically describes a recent shift toward demonstrating that resources are maximized, which is about spending accountability, not combat preparedness. Here's a WGU C214 OA exam tip for you. When a question describes military performance shifting toward fiscal accountability or proving resources are maximized, the answer is about resource utilization. The keyword fiscal pushes you away from combat-related options. Quick recall hook. Military fiscal shift equals prove every dollar. Resource maximization is the new priority. 43. A consulting firm advises that non-profit organizations must focus their performance measurements on 3 key areas to demonstrate effectiveness to investors and guide strategic direction. According to this management consulting framework, which 3 areas should non-profits prioritize when measuring their overall performance? A. Resource mobilization, effectiveness, goal progress. B. Revenue growth, market share, customer retention. C. Production efficiency, defect rates, cycle times. D. Stock performance, dividend yields, profit margins. Can you guess the answer? Correct answer, A. Resource mobilization, effectiveness, goal progress. Explanation. Option A is correct because according to McKinsey & Company, non-profits must focus performance measurements on 3 areas: success of mobilizing resources, employee effectiveness, and progress on their organizational goals. Option B is incorrect because revenue growth, market share, and customer retention are performance measures typically associated with for-profit businesses competing in commercial markets, not the areas specifically recommended for non-profits. Option C is incorrect because production efficiency, defect rates, and cycle times are measures associated with manufacturing and internal business processes, not the 3 focus areas that management consulting recommends for non-profit organizations. Option D is incorrect because stock performance, dividend yields, and profit margins are financial measures for publicly traded companies, and non-profits do not have stockholders or distribute profits as their fundamental organizational purpose. Non-profits operate differently from for-profit companies, and their performance measurement reflects that. According to McKinsey & Company, non-profits should focus on 3 specific areas: success of mobilizing resources, employee effectiveness, and progress on organizational goals. Resource mobilization covers how well the nonprofit attracts funding, volunteers, and partnerships. Employee effectiveness measures whether staff are performing well and contributing productively. And goal progress tracks whether the organization is actually moving toward its stated mission. Revenue growth, market share, and customer retention are for-profit business metrics. Nonprofits don't compete for market share in the same way. Production efficiency, defect rates, and cycle times belong to manufacturing operations. And stock performance, dividend yields, and profit margins apply to publicly traded companies. Nonprofits don't have shareholders or distribute profits. Here's a WGU C214 OA exam tip for you. When a question asks about nonprofit performance measurement areas and mentions McKinsey, remember the 3 R's: resources mobilized, results of employees, and reaching goals. If you see for-profit metrics like revenue or stock price in the options, eliminate them immediately. Quick recall hook: nonprofits measure mobilization, effectiveness, and progress. No stocks, no market share, no profit margins. 44. Schools often receive government funding based on meeting predetermined goals, and standardized tests quantify whether those goals have been achieved. Some educators argue these measures create controversy because rankings may not capture the full quality of education delivered. What makes education performance measures particularly contentious? A. Education never uses any data analysis. B. Rankings may not reflect true quality. C. Schools are exempt from performance reviews. D. Only financial measures drive education goals. Can you guess the answer? Correct answer: B. Rankings may not reflect true quality. Explanation: Option B is correct because a variety of unique and sometimes controversial performance measures have been used in education, and standardized test rankings may not fully capture the actual quality of education being delivered. Option A is incorrect because education extensively uses data analytics, including percentiles, standard scores, item analysis, and growth percentiles to measure student progress, making it a field actively relying on analysis. Option C is incorrect because schools are not exempt from performance review. They often receive funding based on meeting predetermined goals and are held accountable through standardized testing and other mandated measures. Option D is incorrect because education performance measures extend beyond financial metrics to include achievement scores, graduation rates, attendance, and behavioral indicators, making the measurement scope multidimensional in application. Education performance measurement is a touchy subject, and this question gets right at why. Schools receive government funding based on meeting predetermined goals, and standardized tests are used to quantify whether those goals were met. The problem is that rankings based on standardized tests may not actually capture the full quality of education being delivered. A school might rank low because of demographics, funding disparities, or the specific population it serves, not because the teaching is bad. Some educators argue that reducing education quality to a test score misses the point. That's what makes it contentious. Option A says education never uses data analysis, which is flat wrong. Education uses percentiles, standard scores, item analysis, and growth metrics constantly. Option C claims schools are exempt from performance reviews, but schools are actively held accountable through standardized testing and funding-based performance requirements. And option D says only financial measures drive education goals, which ignores the full range of metrics used in education, from achievement scores to graduation rates to behavioral indicators. Here's a WGU C214 OA exam tip for you. When a question asks why education performance measures are controversial, the answer involves rankings not reflecting true quality. Test scores don't capture everything. Quick recall hook: rankings miss the real picture. Standardized tests measure something, but not everything. 45. An organization identifies that customer service quality, operational efficiency, and product innovation are the factors most critical to achieving its strategic goals. In performance management terminology, what is the specific term for these essential factors that an organization determines are necessary for reaching its objectives? A. Key performance indicator targets. B. Balanced scorecard perspectives. C. Critical success factors for the organization. D. Net Promoter Score customer categories. Can you guess the answer? Correct answer, C. Critical success factors for the organization. Explanation. Option C is correct because critical success factors are those factors like quality, customer service, and efficiency that are specifically identified as critical to an organization achieving its strategic goals and desired objectives. Option A is incorrect because key performance indicators are specific, measurable metrics used to quantify progress, whereas critical success factors are the broader essential areas an organization identifies as necessary for its success. Option B is incorrect because balanced scorecard perspectives are the 4 categories of financial, customer, internal processes, and learning that organize performance measurement, not the specific factors deemed essential for goals. Option D is incorrect because Net Promoter Score categories refer to the 3 customer groupings of promoters, passives, and detractors used in loyalty measurement, not the essential organizational factors identified for success. An organization identifies customer service quality, operational efficiency, and product innovation as the factors most critical to achieving its strategic goals. The specific term for these essential factors is critical success factors. Critical success factors, or CSFs, are the areas an organization determines are absolutely necessary for reaching its objectives. They're not the metrics themselves, they're the broader categories that matter most. Once you identify CSFs, you then build KPIs to track performance within those areas. KPI targets are specific measurable numbers, like 95% satisfaction rate. That's more granular than a critical success factor. Balanced scorecard perspectives are the 4 fixed categories: financial, customer, internal processes, and learning that organize performance measurement. Those are structural categories, not organization-specific factors identified for success. And Net Promoter Score categories are the 3 customer groups: promoters, passives, detractors. Used for loyalty measurement, completely different concept. Here's a WGU C214 OA exam tip for you. When a question describes an organization identifying the areas most essential to success, words like critical, essential factors, necessary for objectives. The term is critical success factors. CSFs are the what matters most before you build metrics around them. Quick recall hook. CSF equals what must go right. Identify what's critical, then measure it. 46. A company begins strategic planning by defining its values, vision, and mission to understand why it exists. It then develops goals and objectives for moving forward, and finally creates specific action tasks. Which element of this planning pyramid represents the foundational starting point from which everything else flows? A. Action plan with specific tasks. B. Goals, strategies, and tactics developed. C. Data collection and analysis steps. D. Values, vision, and mission statement. Can you guess the answer? Correct answer, D. Values, vision, and mission statement. Explanation. Option D is correct because the strategic planning pyramid starts with values, vision, and mission at the top, representing the foundational starting point that answers why the company exists before goals are set. Option A is incorrect because the action plan sits at the bottom of the strategic pyramid and represents what the company needs to do, which comes only after understanding the mission and developing clear strategic goals. Option B is incorrect because goals, strategies, and tactics represent the middle section of the strategic pyramid, answering how the company moves forward, developed only after the foundational vision and mission are established. Option C is incorrect because data collection and analysis support the strategic process, but are not one of the three sections of the strategic planning pyramid, which consists of the why, the how, and the what. Strategic planning follows a pyramid structure, and this question tests whether you know what sits at the top. A company starts by defining its values, vision, and mission. That's the foundational starting point. It answers the question, why do we exist? Everything else flows downward from there. The middle section is goals, strategies, and tactics. The how. And the bottom is the action plan. The what. Values, vision, and mission come first because you can't set meaningful goals without knowing your purpose. You can't build an action plan without goals. The pyramid builds from top to bottom. The action plan sits at the base because it's the most specific and concrete layer. Detailed tasks that only make sense once the bigger picture is clear. Goals and strategies are the middle layer, developed after the mission is established. And data collection supports the process, but isn't one of the three sections of the pyramid itself. The three sections are why, how, and what. Here's a WGU C214 OA exam tip for you. The strategic planning pyramid starts with values, vision, and mission at the top. If a question asks about the foundational starting point, or why the company exists, that's always the top of the pyramid. Quick recall hook. Pyramid starts with purpose. Why, then how, then what? 47. A cable company sets a strategic objective to improve customer satisfaction from 70 to 80%. To achieve this, individual phone agents are assessed based on survey responses from customers they personally serve. Why is this considered an effective link between strategy and individual performance assessment? A. Staff goals directly align with strategy. B. Customer surveys are always accurate. C. Agents control all satisfaction factors. D. Phone metrics replace all business goals. Do you know the answer? Correct answer. A. Staff goals directly align with strategy. Explanation. Option A is correct because the link between performance assessment and strategy is critical, and setting individual staff goals that directly support the broader strategic objective demonstrates this effective alignment in practice. Option B is incorrect because customer surveys are not always perfectly accurate and may contain response bias or other issues, but this does not change the principle that staff goals should align with organisational strategy. Option C is incorrect because individual agents do not control all factors affecting satisfaction. But assessing them on customer responses still creates effective alignment between their daily work and the overall company strategy. Option D is incorrect because phone agent metrics would not replace all business goals. The company likely has many objectives, and this illustrates one specific case of aligning individual performance with broader strategic direction. A cable company wants to improve customer satisfaction from 70 to 80%. To make this happen, individual phone agents get assessed based on survey responses from the customers they personally serve. The question asks why this is considered an effective link between strategy and individual performance. The answer: staff goals directly align with strategy. The company's strategic objective is higher satisfaction. The individual assessment directly supports that objective. When an agent knows their evaluation depends on customer survey results, their daily behaviour aligns with the company's strategic direction. That's the link in action. Option B claims customer surveys are always accurate. They're not. Response bias exists, sample sizes can be small, but survey accuracy isn't the point. The point is that the alignment between individual goals and company strategy is what makes this effective. Option C says agents control all satisfaction factors, which is obviously wrong. Wait times, pricing, and company policies all affect satisfaction, beyond what any single agent controls, but partial influence is still meaningful alignment. And option D suggests phone metrics replace all business goals, but the cable company has many objectives. This is just one example of strategic alignment. Here's a WGUC 214 OA exam tip for you. When a question shows individual employee goals tied to a company's strategic objective, the principle is alignment between strategy and performance assessment. The word align is your anchor. Quick recall hook. Strategy flows to staff. Company goal at the top. Individual assessment at the bottom. Connected by alignment. 48. A hospital hired consultants to implement a data-driven performance system, but siloed technology systems, inconsistent measurement definitions, and overburdened staff made reliable data collection nearly impossible across departments. This situation illustrates which critical prerequisite that must exist before any performance framework delivers meaningful results. A. External auditor approval for metrics. B. Elimination of all non-financial measures. C. Data integrity across the organisation. D. Reducing total data collection staff. What do you think is the answer? Correct answer. C. Data integrity across the organisation. Explanation. Option C is correct because performance measurement implementation cannot lead to improvement without data integrity, requiring consistent definitions, accessible systems, and reliable collection processes across all departments and staff. Option A is incorrect because external auditor approval is not identified as a prerequisite for effective performance measurement. The critical need is consistent and reliable data collection practices with integrated systems across the organisation. Option B is incorrect because effective frameworks like the balanced scorecard explicitly require both financial and non-financial measures, so eliminating non-financial measures would undermine rather than support meaningful measurement of results. Option D is incorrect because the problem is not having too many data collectors, but rather inconsistency in how data is defined, measured, and collected across departments, combined with technological barriers to sharing information. A hospital hires consultants to build a data-driven performance system, but everything falls apart. Siloed technology systems won't talk to each other. Different departments define the same measurements differently. Staff are overburdened and can't reliably collect data. The result, meaningful performance measurement is impossible. This scenario demonstrates a critical prerequisite: data integrity across the organisation. You can have the best framework in the world, but if the data feeding it is inconsistent, inaccessible, or unreliable, the whole thing fails. Performance measurement cannot lead to improvement without clean, consistent data flowing from every part of the organisation. External auditor approval isn't a recognised prerequisite for effective performance measurement. Eliminating non-financial measures would actually undermine good frameworks like the balanced scorecard, which requires both financial and non-financial metrics. And reducing data collection staff misidentifies the problem. It's not about headcount, it's about consistency in how data is defined, collected, and shared. Here's a WGUC 214 OA exam tip for you. When a question describes siloed systems, inconsistent definitions, and unreliable collection making performance measurement fail, the prerequisite is data integrity. Without clean data, nothing works. Quick recall hook: garbage in, garbage out. Data integrity is the foundation everything sits on. 49. When a balanced scorecard dashboard shows certain indicators highlighted in red because they have moved beyond an acceptable range from their target, management typically investigates root causes and develops corrective plans. What does a red indicator on such a dashboard specifically signal to organisational leadership? A. The target was significantly exceeded favourably. B. Performance has unfavourable variance beyond threshold. C. The measure should be permanently removed. D. Data collection for that metric stopped. Do you know the answer? Correct answer. B. Performance has unfavorable variance beyond threshold. Explanation. Option B is correct because red indicators on a balanced scorecard dashboard signal that performance has moved outside an acceptable unfavorable variance threshold from the target, requiring immediate management attention and investigation. Option A is incorrect because significantly exceeding a target favorably would typically appear as a green indicator for desirable measures, not as a red warning signal that triggers investigation and the development of corrective action. Option C is incorrect because a red indicator signals that performance needs improvement and investigation, not that the measure itself should be permanently removed from the dashboard or abandoned as a metric being tracked. Option D is incorrect because a red indicator means performance data has been collected and shows unacceptable variance from the target. It is an active warning signal based on actual results, not a data collection failure. Balanced scorecard dashboards use color coding to communicate performance status at a glance. When an indicator turns red, it means performance has moved beyond an acceptable, unfavorable variance threshold from the target. Red is the alarm bell. It tells leadership, this metric is off track, investigate immediately, and develop a corrective plan. That's different from green, which typically signals favorable performance, targets met or exceeded where higher is desirable. Option A says red means the target was significantly exceeded favorably. That's actually what green would indicate. If you exceeded a desirable target, that's good news, not a red warning. Option C suggests a red indicator means the measure should be permanently removed. That misreads the signal entirely. Red means fix this, not delete this. And option D claims data collection stopped. Red means data was collected and the results are bad. It's an active signal based on actual results, not a collection failure. Here's a WGUC 214 OA exam tip for you. Red on a BSE dashboard always means unfavorable variance beyond the acceptable threshold. Red equals alarm, not achievement. Green equals on track. Quick recall hook. Red means react. Something broke the threshold and needs immediate attention. 50. A company must understand its current position before setting future strategic goals, and it must collect and analyze data to track progress towards those goals over time. This demonstrates that strategic planning at every stage fundamentally depends on which core organizational capability to be effective. A. Outsourcing all planning to consultants. B. Avoiding non-financial outcome measurement. C. Limiting goals to one department only. D. Data collection and analysis capabilities. Do you know the answer? Correct answer. D. Data collection and analysis capabilities. Explanation. Option D is correct because setting strategic direction requires understanding current position through data, and reaching goals requires ongoing collection and analysis, making this capability fundamental to the strategic process. Option A is incorrect because while consultants can support strategic planning, the fundamental organizational capability required is internal data collection and analysis ability, not dependence on outsourcing the planning process entirely. Option B is incorrect because effective strategic planning requires measuring both financial and non-financial outcomes, and avoiding non-financial measurement would leave the organization with an incomplete understanding of its actual performance. Option C is incorrect because strategic goals typically span the entire organization and require coordination across multiple departments, making it counterproductive and ineffective to limit strategic goals to only one single department. We'll close out with a big picture concept that ties the whole course together. A company needs to understand where it currently stands before setting future goals, and it needs to collect and analyze data to track progress toward those goals over time. What core capability does strategic planning depend on at every stage? Data collection and analysis capabilities. That's the engine beneath everything. You can't assess your current position without data. You can't set meaningful goals without understanding where you are. And you can't track progress without ongoing collection and analysis. Data is the thread that runs through the entire strategic planning process from start to finish. Outsourcing all planning to consultants makes the organisation dependent rather than capable. The fundamental need is internal data capability. Avoiding non-financial measurement leaves you with an incomplete picture. Effective strategy requires both financial and non-financial insights. And limiting goals to one department ignores the fact that strategic goals typically span the entire organisation and require cross-departmental coordination. Here's a WGU C214 OA exam tip for you. When a question says strategic planning at every stage depends on something, the answer is data collection and analysis. Data is the constant throughout the cycle, from understanding the present to tracking the future. Quick recall hook. Data is the thread. It runs through every stage of strategic planning. No data, no strategy. You have reached the end of our first question set. For the free complete exam preparation, visit our website, link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.